Hello, everyone. Today we are looking at management of a patient with upper respiratory tract disorder, or we are looking at management of patients with upper respiratory tract disorders. All right, my name is Jones. Okay, and we are in the series of looking at different conditions in pediatrics. So the first condition that we are going to look at in the upper respiratory tract disorder is Coryza. The other name is common cold. So this is an acute, mild, and self-limiting catarrhal syndrome, and mostly it is caused by rhinovirus, but also by adenovirus. You can also define it as an acute, usually a febrile infection that is characterized by inflammation of the mucosal membrane of the nose and accessory sinuses. Let's look at the mode of transmission of this disease. So, mode of transmission is by inhalation of airborne respiratory droplets from people infected with the virus. So, direct contact with infectious secretions, like for instance by handshake, can also transmit this disease. The other ways this disease is transmitted is most commonly occurs. The way this disease is transmitted mostly commonly occurs in homes, school, daycare center, and the main reservoir mostly is young children. Epidemiology. So adults have an average of 2 to 4 colds a year, and adults with children at home have more colds because children tend to suffer from colds more frequently than adults. So if they have children at home, they're likely to catch the cold. Of course, coming from children. The annual epidemics occurs within the colder months in that is in temperate climates and during the rainy season in the tropics. The disease, how is its clinical manifestation or how is its presentation? So, most frequently, symptoms are nasal discharge, nasal obstruction, sore throat, headache, and cough. Hoarseness, loss of taste, and smell are some of the signs and symptoms that the patient may present with, but they may also have mild burning of the eyes and the feeling of pressure in the ears or sinuses. And this is mostly due to the obstruction or mucosal swelling that occurs. Other presentation of the condition is that you may see mild increase in body temperature. Young children may even develop temperature which is even higher. All right, so that's all on Coryza. Let's look at another respiratory disorder, the upper respiratory disorder called hay fever. All right, well, maybe before we go to that, maybe we can look at the management of common cold or Coryza. So its management is centered around providing symptomatic relief. It's caused by a virus. So it's centered around providing symptomatic relief and ensuring adequate fluid intake. Analgesia or antipyretics like paracetamol are given in instances where temperature is high or where there is altered thermoregulation. Antihistamines may also improve runny nose by helping to dry the secretions. And decongestants, for instance, noephedrine, can also be given in order to reduce on the secretions within the respiratory airway. Steam inhalation has also been used in treating common cold, and research has also shown that vitamin C and zinc reduces the duration of a cold symptoms. All right, so now we can move on to hay fever. So hay fever or allergic rhinitis, it may be called. By definition, it is caused by pollen of specific seasonal plants, airborne chemicals, and dust particles in people who are allergic to those substances. It is characterized by sneezing, runny nose, and itching eyes. So it's a respiratory disorder or a respiratory condition which is caused by specific seasonal plants or allergic reaction to seasonal plants, okay, and chemicals. So that is what is known by hay fever or allergic rhinitis. So the seasonal allergic rhinitis mostly occur during what we call a haying season. That is the late May to end June. That is what they call the haying season, harvest season. Okay. So when the pathophysiology, let's talk about the pathophysiology of this condition. So we are saying when an allergen like pollen or dust is inhaled by a person with a we can say with a sensitized immune system, it's going to trigger an antibody production. These antibodies mostly bind to mast cells which contain histamine. So when the mast cells are stimulated by pollen and dust, histamine and other chemicals are released. This may then cause itching, swelling, and increased mucus production. So symptoms vary in severity from person to person, and very sensitive people develop other rashes apart from upper respiratory condition. All right, so that's the pathophysiology of hay fever. Now let's look at treatments. Okay, we have a continuation of the pathophysiology there. So the two categories of allergic rhinitis include seasonal, that occurs particularly during pollen season, and seasonal allergic rhinitis develop after 6 years of age, may not develop earlier than that. And then we have perennial that occurs throughout the year. So this type of allergic rhinitis is commonly seen in younger children, the perennial. So the two categories of allergic rhinitis that we look at are seasonal and perennial. Okay, so now let's look at treatments. Here, the treatment is remove the causative agent from the environment of the patient. That is, avoid allergens. Okay, if at all allergens cannot be avoided and the person is exposed, then give antihistamines like chlorpheniramine and promethazine as they help to relieve the symptoms. So nasal treatment like steroid nasal sprayers like beclomethasone can also be administered. But you have to remember when you administer the steroid, it should not be for more than 14 days because it may predispose you to other conditions. So that is on hay fever. Let's now look at sinusitis. Sinusitis. Okay, so this is the inflammation of the paranasal sinuses, itis for inflammation. So it's an inflammation of the paranasal sinuses. So this is secondary to bacterial, fungal, viral, allergic, or autoimmune issues. That is how the disease may arise. Okay, so predisposing factors to this include allergies, structural problems such as deviated septum or small sinus ostia. Smoking and nasal polyps also predisposes one to sinusitis. What are the classification of sinusitis? So here we have to look at the classification as by location. Let's say maxillary, frontal, ethmoid, and sphenoid. So we can say maxillary sinuses are going to have maxillary sinusitis. Causes pain or pressure in the cheek area, that is e.g. that is the headache that you're going to have. More on the cheek bones, cheek area, maxillary sinusitis. With frontal sinusitis, mostly it's going to cause pain or pressure in the frontal sinuses or cavities, frontal bones, so frontal sinuses. Then ethmoid sinusitis. This may cause pain or pressure between or behind the eyes, between or behind the eyes. So that is ethmoid sinusitis. All right, then sphenoid sinusitis causes pain or pressure behind the eyes, but often refers to the vertex of the head. So we're saying classification is by the bone that is involved or by location. By location, that is how you classify sinusitis. Duration. So in acute stage, it will be less than 4 weeks, and subacute it will be 4 to 12 weeks. But in chronic, it will be 12 weeks or more. Acute is necessarily precipitated by an area but a viral upper respiratory tract infection. Then chronic sinusitis is complicated. It's a complicated spectrum of diseases that may cause it. How is the clinical picture of this condition? So nasal congestion, facial pain, and headache or fever, general malaise can be noticed in this patient. There can also be thick green or yellow discharge. Vertigo or lightheadedness can also be observed in the patient. If other symptoms may include blurred vision and feeling of facial fullness or tightness. This may worsen on bending over, and sometimes some people may also feel some aching teeth, and halitosis also may result. So that is, in a brief way, that is the clinical feature of sinusitis. All right, so now let's look at how breast sinusitis can be managed. So blood studies like skull X-rays can be done, rule out polyps and other things that you can rule out from the X-ray. So you can do a facial X-ray or skull X-ray. Okay, then okay, so sorry. So then you can also look at antibiotics like penicillin V, which helps to treat these conditions. Okay, it helps to treat these conditions. All right. So surgery, that is sinus diffraction or incision and drainage, when it is chronic, can also be done. Otherwise, the swabs aspirate for microscopy and culture sensitivity. These are taken to identify the causative organism. We can do the rhino manometer or sinogram. Those are some of the investigations that can be done just to arrive at the diagnosis. Okay, so let's move on to another condition of the upper respiratory tract, upper respiratory tract, and that is laryngitis. Laryngitis. So this is an infection, acute or chronic infection of the upper respiratory tract, and it involves inflammation of the larynx. It causes someone to have a hoarse voice or the complete loss of the voice because of irritation that happens to the vocal cords. The causes can be viral, bacterial, or fungal infection. Inflammation due to overuse of the vocal cords can also inflammation due to overuse of the vocal cords can also lead to laryngitis. Excessive coughing, smoking, or alcohol consumption also predisposes one to laryngitis. How is the clinical presentation, or what are the symptoms? So the patient is going to have impaired speech that ranges from a raspy hoarseness to the total loss of ability to speak. Mostly they will lose the ability to speak, and you can only hear them nicely when they are whispering. Maybe except when they are whispering, that's when you are able to get what they are saying. Okay, so they will lose a voice that they cannot speak loudly, but when they are whispering, their voice becomes a little bit clearer. So, other signs and symptoms that we see include dry sore throat, coughing, difficulties in swallowing, and sensation of swelling in the area of the larynx can also be felt. Swollen lymph glands, fever, difficulties in breathing, mostly in children, this can be seen. All right. So it's now time now for us to look at how to treat this disease. So due to gastroesophageal reflux, you can use Zantac, and due to bacterial or fungal infection, you can use antibiotics or antifungal medication. Persistent hoarseness or loss of voice due to vocal cord nodules, surgical procedure or speech therapy can be done to help the patient. Reduction of high impact stress to the vocal cords that is caused by loud, frequent, and high pitched voice is recommended. Okay, so it's important to use the microphone if you're addressing a very big crowd so that you don't stress your voice. Okay, let's now look at pharyngitis, pharyngitis. So this is an acute or chronic infection that results in the inflammation of the throat or the pharynx. In most cases, it is painful and often referred to as a sore throat. Tonsillitis and laryngitis may occur simultaneously, and this can make eating very difficult and painful, or patient may have dysphagia. The causes of pharyngitis includes viral pharyngitis, and this accounts for 40 to 60% of the cases. Adenovirus, Epstein-Barr virus, herpes simplex virus, rhinovirus, and coronavirus are some of the viruses that may cause inflammation of the pharynx or may cause pharyngitis. When you're talking about bacterial pharyngitis, most common groups are Streptococcus A or Streptococcus A, group A Streptococcus. That is, others may include Corynebacterium, diphtheria, Neisseria gonorrhoeae, and Mycoplasma pneumoniae. So these may constitute bacterial pharyngitis. Of course, treatment will be according to the cause, but for viral, we are saying symptomatic and some other remedials or supportive treatment can be given. So analgesics can be given as steroids like dexamethasone, throat lozenges, and other cough medicine can be given in treating the patient who is symptomatic. Remedial antibiotics can be given and viral drugs can be given in order to treat the actual cause of the disease. All right. So let's look at another disease of the upper respiratory tract, and that is tonsillitis. So we're looking at tonsillitis. So by definition, it can be an acute or chronic infection that causes inflammation of the tonsils. So there are three main types of tonsils. There are three main types of tonsillitis. It can either be acute, subacute, or chronic. Acute is either bacterial or viral in origin. Subacute is caused by bacterial actinomyces, whilst chronic is almost always bacterial. It's important that you note this. So, what are the causes of tonsillitis? So, we have group A, streptococcal bacteria, resulting in what we call strep throat, and then we can also have viral tonsillitis that is caused by Epstein-Barr virus or adenovirus. Tonsillitis is also caused by a superinfection of the spirochete and treponema. It's important that you also note these things. All right, so tonsillitis can be as a result of an aberrant immune response to the normal bacterial flora or the nasopharynx, because the tonsil tissue is part of the immune system of the body. Symptoms: the symptoms of the tonsillitis may include severe sore throat, painful or difficulties in swallowing, crouch coughing, headache, fever, and chills. Tonsillitis is characterized by signs of red, swollen tonsils which may have a purulent exudative coating of white patches or pus around that. So there may be enlarged and tender neck cervical lymph nodes that can be seen as a defense mechanism towards the infection. Treatment of tonsillitis. So penicillin, common use, or erythromycin for patients who are allergic to penicillin, that can be done. Topical anesthetics, e.g., lidocaine for temporary pain relief, can be sometimes given. But otherwise, if this is not an option, you can give ibuprofen to decrease the edema and inflammation and to also ease the pain and allow patients to swallow liquids without problems. So chronic cases may be an indication for tonsillectomy. When the disease is chronic, it's a procedure where they go to cut out the tonsils. So other ways you can treat tonsillitis is through some gargling with a solution of warm water and salt. This helps to reduce pain and the swelling. Complications of tonsillitis. So you can have a peritonsillar abscess, which we call quinsy, and it can allow for septicemia. When you have the quinsy, the abscess, it can allow for someone to become septicemic. The other complication is that it can become chronic or become recurrent. Patients may start having recurrent episodes of tonsillitis. The other complications include tonsillar hypertrophy. Due to frequent infection, the tonsils hypertrophize. So in very rare cases, diseases like rheumatic fever or glomerulonephritis can occur as a complication. All right, so let's look at another disease of the respiratory upper respiratory tract, tracheitis. So this is the bacterial infection of the trachea and is capable of producing airway obstruction. It is mostly caused by Staphylococcus aureus and often follows a recent viral upper respiratory tract infection. So for symptoms or signs and symptoms in this condition may include most serious in children and to small trachea that can easily get blocked by swelling, and sign is of rapid development, leading to a noisy breathing called stridor, and occasionally the child may become confused with croup. Others may include scratchy or feeling in the throat, chest. You feel a scratch feeling within your thoughts, like you want to scratch your thoughts. You may also have chest pain, a fever, earache, and intercostal retraction. All right, so we're looking at management of patients with upper respiratory tract infection. We mentioned different upper respiratory tract infections and brief management of these diseases. Please, if there is anywhere where you're not clear, feel free to suggest by commenting below this video so that we can always come up with another video that can supplement and help you understand the condition even better. So thank you very much.